San Antonio school children began their 2020 spring break vacation, only to learn it wouldn't end as planned.
Did I know it was going to impact our schools? Absolutely. Did I know it was going to shut schools in the way that it did? Absolutely not. I don't think anybody could predict that.
A lot of lessons have been learned in this pandemic year.
The pandemic helped change the way teachers teach.
The COVID pandemic has dramatically affected how students learn.
Virtual learning, it's here to stay. Parents were left at home watching grades go down and depression go sky high.
We have advisory groups made up of parents, and they share with us how their children are depressed, they're feeling isolated.
Doctors are bracing for a rise in cases among kids once school starts.
The American Academy of Pediatrics today calling for schools to enforce universal masking mandates, even if children and their teacher are vaccinated.
And naturally, parents have a lot of questions and concerns.
The world of learning forever changed.
Hi, good morning. I'm Stephanie Cerna. Thank you for joining our KSAT Community Back to School Virtual Town Hall. We are less than a week away from when a lot of San Antonio students head back to school. Throughout the pandemic, educators, students, and parents have run into a lot of changes and challenges and have been forced to adapt. And much like the past few semesters, school may look very different this fall. In just a moment, we will be joined by a panel of experts to talk about how the classroom has evolved, COVID concerns, and how parents can prepare their kids for this transition. But first, we want to remind you that this is all about getting your questions answered. To join the conversation, you can just head to our website at ksat.com right now and look for this article. That's where you can submit your questions for the panelists, and we will try to get them answered within the hour or in our second back to school live stream that's coming up next week. For now, let's go ahead and introduce you to our panelists. First, we have Maricruz Martinez, a second grade teacher at Harlandale ISD and a member of the Texas State Teachers Association. We have Inga Cotton, the founder and executive director of San Antonio Charter Moms, a nonprofit focused on providing parents with resources to find the best education for their child. We have Ashley Jesse, the program director at Paloma Place, part of the Children's Bereavement Center of South Texas. She has over 12 years experience in mental health and currently works with children to cope with trauma, grief, anxiety, and depression. And then we have Dr. Mandy Svatek, a pediatric hospitalist at University Health and associate professor at UT Health, also a mother whose young teen daughter participated in the Moderna vaccine trial last year. Thank you all for joining us this morning.
Thank you.
And I want to start the conversation by giving each of you a chance to explain what kind of challenges you have experienced this past year in regards to children and education, whether personal or professionally. So, Ms. Martinez, let's start with you.
Gosh, everything changed. Teaching is not easy as it is, but with COVID and all the different things that we were facing, everything changed. We started, teaching remotely. During COVID, I was a pre-K4 teacher, so you can imagine teaching 4-year-olds online. It was difficult, very difficult, but we did it, at every grade. I am now a second grade teacher, but I did teach pre-K4. Everything changed, and I hear the different concerns, about the depression and all. And yeah, we saw a lot of that. Everything changed for the children, for the adults. But we worked through it, and we're hopefully in a way better place now. We're more alert, and we understand things a lot more. We're stronger for it because, as human beings, we're very resilient, and we've moved along with it and learned from it. And this year, hopefully, will be a lot better.
And thank you for that response. We'd like to get another response from, I guess, who would like to go next?
I'll go ahead. So I have two kids. I have my daughter is 11, my son is 14, and they both did distance learning for most of the last year. And I noticed a big difference when my daughter got to go back on campus, that she felt much more connected. And so it's I think as families think about back to school, as our family thinks about back to school, I know there will be a lot of benefits to my kids of being on campus and having that interaction with their peers and with their teachers and the amount of engagement they'll have. But I just can't help being worried because my daughter is too young to get the vaccine yet. And so we've been talking as a family about how to be safe and how to get her back on campus. So I'm excited about the kind of learning they'll get this year, but just nervous about how these next few months are going to play out.
All right, Inga Cotton, thank you. Also, Ashley, Jesse, would you like to say something?
It's been, sometimes I think it's hard to find the words for what 2020 was like. Professionally, I was having to do online counseling with my clients, and I do work with children as young as 3. And in that case, it's challenging to do a telehealth session with a 3-year-old. And so I would work a lot with their parents through online sessions. And so that was challenging, but we adapted and we learned just to make sure we were able to be connected to these families that were grieving, but not only grieving the death of a loved one, but also going through the stressors of the pandemic and the anxiety and the uncertainty that goes along with that. In addition, I have a 21-year-old daughter in college and a 7-year-old daughter. And so both of them were doing virtual learning, and it was also challenging. So I was working from home doing virtual counseling and also making sure that my little one was able to get her learning in. And it was extremely challenging. I was so happy when I was able to send her back to school, which we decided last fall to send her back to school. And I just noticed a difference in her mood. She was happier, she was sleeping better. And it's been challenging for everyone. And I think through all of that, we have learned how to deal with things that just come out of the blue that you don't expect. And so it's been challenging, but I think we're the better for having gone through something so difficult.
Definitely, I agree, Ashley, Jesse. And also, Dr. Svatek, can you share your experience as well?
Right. So the first thing that comes to mind for me is being a working mom, just like a lot of these ladies have reiterated. And that was a huge challenge because I didn't want anybody else coming into the home, and being a clinician, how was I going to balance that time, ensure that my kids were doing okay? I have a 14-year-old, 11-year-old, and a 10-year-old. And obviously that was a year ago. So they were a year younger, and then having to be in that environment of trying to figure things out and trying to communicate with them while I'm at work. And then the days that I didn't have clinics, being at home, and how I had, academic duties. It was really difficult to assure that their virtual learning was going the way that I wanted, especially with my younger son. And he was on Zoom for quite a few hours, and I didn't realize that because I couldn't be over his shoulder. So I think that dynamic, thinking about my environment and then thinking about all the other families that are experiencing similar things with younger children, really opened my eyes. If I'm getting hit hard, I can't imagine how other children are getting hit hard. And so, from a pediatrician standpoint, everybody's reiterated the health, the well-being of the child, extremely important. But then you have this evolving, disease process and safety measures that we were initiating. But still, this uncertainty, are we doing all the right things? We don't have studies. This is our first time through this. I did get my children back in school as soon as possible, but tried to obviously ensure that school was doing their schools were doing all the right things for protecting the children. And were those the right things? And so that's where this comes, is I got them back in school. Obviously I saw that environment more enriching for them as opposed to the home environment. Being on the inpatient wards, I take care of sick children in the hospital. We had a lot of mental illness, children with anxiety and depression and heightened events that led them into the hospital because of that. So, this was a really difficult time for many, many families. I'm glad, that now we have some data that's showing with certain factors of mask wearing and social distancing that we've made some progress. And that the schools were showing successes as opposed to failures in helping and enabling them to get the children back to school. So sorry that, long take, but it's important to understand that this is a constantly evolving situation, and we're trying to do our best to figure things out.
Thank you, Dr. Svatek. And a lot of what you're talking about, the virtual learning, a lot of our viewer questions have been focused on virtual learning. They say it worked for them and their families, but now it's not an option for most schools for this school year. To explain why, our producer, Alyssa Medina, spoke with Pedro Martinez, the superintendent of SAISD.
So initially, as we were looking at this new school year, this was as we're finishing last school year in June, we planned to do virtual, having remote options or virtual learning for our families who needed it. One of the challenges that has occurred, though, is that the session ended last year. The legislative session ended without giving us the authority to be able to provide virtual instruction. And so that's going to be, this is statewide. And then we were hopeful that in the special session that they would have look at it again, because there was a bill that was supported by both sides of the aisle that we felt very confident that was going to pass. Just the way the session ended, they didn't even get a chance to vote on it. In the special session, again, the same legislator put his bill again for it to be considered. But unfortunately, unless the governor authorizes that bill to be heard, they can't even hear it or vote on it. And so that's our challenge right now. There's just no legal way for us to provide virtual instruction. But with that, though, I am very concerned about children that may have medical conditions that are not eligible for vaccines. And so what we're going to be doing is we have a program where we provide homebound services. These are for children that, for medical reasons, have to be at home. Even if it's for temporary times or temporary periods of time. So we are going to expand that program. And so our goal is to just talk to families and if their children have medical conditions and are not eligible for vaccines, we want to be able to still provide services so they can still be part of our district. It'll look different than virtual instruction, but that's our plan right now.
And again, that was Superintendent of SAISD, Pedro Martinez, and of course, school starts for them on August 9th. And we have a viewer question that we'd like to offer up to Inga. It says, if virtual learning isn't offered, what can parents do? My kids aren't comfortable going in person because of kids and staff being unvaccinated. Where can we go to get them an online education until then?
Yeah, that's a question. It's coming up a lot in our discussion group on Facebook. So it's San Antonio Charter Moms discussion group, and it's a really tough situation because, like Superintendent Martinez said, there were bills that could have fixed this, but that didn't pass during the legislature. The governor and the education commissioner are not taking action. What was offered last year, where families had the flexibility to choose virtual or in person, that's not available. There in Texas, there have been virtual schools that existed even before the pandemic. Unfortunately, they don't start until grade 3, and there's sort of certain eligibility requirements. So we have a guide on our site. If you look for, full-time online schools, we have a list of those, Texas Virtual School Network programs. There's also private online schools, and they are still taking applications, but there is a tuition cost. And the other option is homeschooling. Homeschooling has jumped up dramatically during the pandemic. And I think some families, once they tried it, they find that it does work for their family. And there are families who manage to work and homeschool. It's hard, it takes teamwork, it takes the whole village pitching in, but that may be the good option for, at least in the short run, for some families. Like, you don't have to commit to do it till 12th grade, if you just needed to get through this situation, maybe until younger kids are vaccine eligible. But my best advice overall is just talk it through, talk to your family's doctor, talk to, any mental health professionals in your family, talk it through with relatives, ask your village who can pitch in, who can help, talk to your kids' school, find out what measures they're taking to keep kids safe on campus.
And thank you, Inga, for touching on that. We appreciate the feedback. We also have another question submitted by Misty Hammonds. This next question, she says, what protocols will be in effect if a teacher or a student tests positive? So first, we're going to hear how SAISD plans to handle case notifications. Then I'll pose the question to Ms. Martinez to see how Harlandale is preparing.
we're going to do what we did last year, Alyssa, which is we notify parents. In fact, if any child is exposed, and not only do we notify the parents, I ask the principals to do personal phone calls. Because as a parent, I appreciate a personal call, especially to know like what happened in my classroom, right? And especially because we have to be so careful about what information we can share, because we have to adhere to privacy laws for both our staff and students. So we'll continue to do that, and as well as we will continue to publish cases at our schools on our website. And so we do weekly cases where we show every single school, and we do a 4 weeks, each of the 4 weeks, what the cases have been. Alyssa, that's what last year gave assurance to our elementary families. So once they saw that cases were almost zero, especially as we got into the spring, that's when more families wanted to come in person. And so for us, we learned some good lessons last year, and we really built trust with our families and our staff. And so we want to maintain that. So for us, we want to be transparent. We want to make sure, as a parent, I want to know if there's a case in my school. More importantly, if my child was at risk of exposure, I frankly want a personal phone call. And so that's going to be what we're going to have in our schools this next year.
And Maricruz Martinez, how is Harlandale responding?
Well, as he just shared, there are many privacy laws. So, it's a situation you have to be very careful with. But the district does let everybody know, or each campus, as if they happen, they let everybody know. They receive a letter, all the parents, something is sent out. And the nurse, I know, contacts the family, and if other parents have questions or more specific, they do address them within the campus. But everybody is notified that letter goes out. A letter goes out to everybody, letting them know that there was a case in the campus, on the campus. And I also know our district also reports the numbers as he shared, if there is cases in the district. So yeah, it's notices go out, they go out immediately. And that's pretty much all we can do as far as, because there are many privacy laws.
Thank you, Ms. Martinez. As for some of the other major districts, Northeast Independent School District initially said it would not send notifications to parents of positive COVID cases, and then reversed the decision following some backlash. So districts are beginning to post their protocols plans online, so you can head to KSAT.com and find your child's school in this article. Now, in a poll released earlier this year by the San Antonio Report and Bare Facts, 73% of parents said they think masks should still be required in school. Since then, Governor Greg Abbott has signed an executive order prohibiting mask mandates in schools. But still, a lot of parents, like our next viewer, are just asking, are kids going to be wearing masks in school? So let's first hear from Ms. Martinez.
Yes, so sadly, we're not able, it's not a mandated, mask wearing is not mandated. But we're going to strongly suggest and strongly remind, or not strongly remind, but strongly suggest that they do wear masks, that we all wear them. I'm vaccinated, but I wear my mask. I'm by myself right now, so that's why I don't have mine on. But more than you see me with it all the time. It's safety. We need to keep our students safe and ourselves safe, and we don't want anything to happen where it's passed around, taken home, and many children are being raised by elderly grandparents. We need to think about all that and just wear a mask and stay safe. I taught pre-K4 during the pandemic, and those 4-year-olds could do it. Maybe a week in the beginning once they started coming back, because I ended up having pretty much all my students in person except one, which I understood the parent. We have our that was a choice. We had our rights to choose stay home or come to school, and she chose to keep hers home. But all the ones that did come, 4 years old, maybe a week of reminders, just a quick reminder, and they put it on. And so thankful, entire school year, no nobody in my classroom, and pretty much no one in pre-K or the teachers, the adults, became ill. You know, we didn't get the COVID. So it's very important to wear our masks to stay safe and to keep others safe.
Well, thank you so much, Ms. Martinez. And wanted to ask Dr. Svatek, what are your feelings on mask wearing?
Right. So, you know, the mandate that's difficult, and that puts individuals in a difficult situation. But what we do know is that the American Academy of Pediatrics has looked at this and has known that getting back to school is extremely important. And how can we do this based upon studies in a safe manner to still reduce transmission? And they found that mask wearing was number one. And they found that, you know, children 2 and above are capable of wearing masks, and that they can do that in the school environment. And I know as a mom, you know, telling my children, hey, you know, when we get back to school, we've got to wear a mask. Yes, there was size and ugh, I thought we were done with this. But, you know, as a pediatrician and as a parent, to protect my children, I have 2 that are unvaccinated at this point. It's important that we continue to reiterate, hey, if, you know, I don't want my child getting sick with COVID. I don't want to take that chance. There's still associated deaths. There's still multi-system inflammatory syndrome of childhood, MIS-C. And I don't know which child is going to be affected over others, although those rates are low. Hospitalization rates are at less than 1%. But I still think I'm not a gambler. I'm a parent. I'm a pediatrician that's been enriched with knowledge and understanding what are our best practices that we can do. And if we can team up and be a team and work together to eradicate the transmission of this virus by simply wearing a mask, I say, let's do that. Let's come together as a team and know that the sooner that we do this, the sooner that we can potentially eradicate this and move on and move forward to where we're back in that environment where we're not having to wear a mask. We also know that we're going to protect against other viruses, because everybody knows as a parent, when that school comes around, it's like, oh, here comes this virus and here comes that. Flu, RSV are here. We have many patients right now that I saw last night hospitalized with RSV bronchiolitis. And these are our younger kid populations, but our older kids are being affected by these viruses as well, and some getting hospitalized as well. So we have to think about, you know, we can reduce transmissions right now, especially when there's a bunch of viruses, including the Delta variant of COVID, being more virulent and spreading a lot more. So, you know, if that requires just a simple, you know, wearing of a mask, we can team together, even though there's not a mandate. You know, and like I said, reiterating the AAP recommendations, 2 and above can do this.
All right, thank you, Dr. Svatek, for touching on all of these points. Very important for parents to know this. We also have a question for Ashley Jesse about right now, children under the age of 12 are not eligible to get vaccinated, but maybe their parents and older siblings are. Plus, throughout the summer, these students mostly at home, and they've gotten used to not wearing masks, you know, a little bit like what Dr. Svatek was saying. Ashley, how can parents get their kids back into the groove of wearing those masks without too much confusion?
I think it's just important to talk with them. I mean, you can talk with a child that's very young and explain things in a way that they understand. So, you know, you can tell a little one, I mean, even a 2-year-old, you can say, you know, it's really important that we, you know, that we wear a mask because it can keep us safe and other people safe from getting sick. You know, when we get sick, we get these germs in our bodies that can make us very sick, and we can pass those germs on to other people. So just explaining it in a way that they understand. And, you know, if they've gotten out of the routine of wearing a mask, you know, just practicing wearing the mask again. There was a little while when I had stopped wearing my mask. You know, I had gotten vaccinated and I was like, I think it's safer. And then the Delta variant came around. And so we started wearing our masks again. Anywhere we go in public, we wear a mask. When I work with children in person doing sessions, I wear a mask. We, you know, highly encourage that families and their children wear masks as well when we're interacting. Just preparing them and getting them into that routine, and they'll get used to it. It just takes a little bit of time.
Thank you so much, Ashley. I want to go back to Dr. Mandy Svatek one more time. What do we know about the progress of vaccinations in children under 12?
Right. So, the FDA is being cautious. So what really evolved over these past couple of months was these cases that we were hearing on the news of vaccine-associated myocarditis, so inflammation of the muscle in the heart. And they were looking at the total number of cases, and as of June, they found about 1,226 cases of myocarditis associated with the COVID vaccine. And that's for that age group of 12 to actually 29. So they were really looking and examining. The majority of these cases, it looks like, had self-resolved, meaning they got better on their own. But then let's look at the number of COVID cases and the number of what we call the MIS-C cases. And that's about 4,000 cases, so much more. And there can be associated, myocarditis, pericarditis, so as well as affecting the arteries around the heart. So there's actually more cases associated with MIS-C than with the vaccine. And if we think about how many doses, we had about 1,200 cases and 53 million doses received. So that's less than 1% of that population self-resolving. With the MIS-C and the myocarditis, also, most of those patients got better on their own. But again, we kind of compare risk and benefit. And so what the FDA wants to do is, they want to examine the younger population a little bit more as they continue to recruit further patients that are younger receiving these vaccinations. They want to assure all of a sudden that doesn't bump. Those cases don't bump to an extent that we worry about that risk and benefit of the vaccine. And so, they are being cautious. I do agree with kind of their methods. We don't want to jump into this and then find out later. But look at the studies, look at the patients. Are they being affected more in the younger population with myocarditis? I hope not. But we need to establish that first. And so the initiation of the vaccines was thought to be right before school was going to start, but it's going to look at being sometime during after school starts, but hopefully sooner than later as that data rolls in from Pfizer and Moderna and some of the other vaccine companies. So this is going to take some time, but we know the risk of myocarditis is less than 1% associated with the vaccines, but we need to be safe because we're looking at children younger than 12. So it's important, again, that we look at the data, we compile it, and then we look at the recommendations made by the CDC and the FDA.
All right, Dr. Mandy Svatek, thank you for breaking that down for us. And for now, let's go ahead and hear from Superintendent Pedro Martinez. He says the district is encouraging vaccinations and preparing for further use in kids.
We expect, Alyssa, that vaccinations for younger children between 5 and 11 could be approved early this fall. And so we want to be prepared for our families, and that's why we're being so aggressive. When you look at the number of vaccination clinics we're going to have, I would challenge anybody to find anything that large, especially here in our region. And so all of our high schools, we're planning to have, the goal is to have in our comprehensive high schools to have vaccination clinics in all of our large high schools. And so for us, and they're open for both children and for our families. And then we will also help our middle school students get to those places as well. And so we're going to be very supportive and really encouraging our families to take advantage of vaccinations. But then, like I said, Alyssa, for us, then it's back to safety procedures, especially for children who are not eligible. And our data is very clear from last year. Our cases and transmission was very low, and our transmission was almost virtually zero. And so for us, we know that works. We are partnering with community labs again for this new school year. We're actually helping them to hopefully secure their funding so that we would have testing again, at all of our campuses. And so again, it's just that also gave a lot of assurance to our families, even as cases were rising in the community.
And switching the topic a little bit about testing, students have had to adapt to a lot of changes, and with change comes challenge. According to the Texas Education Agency, standardized test scores have dropped in the last year. And Amari Cruz Martinez with Harlandale ISD, what is your reaction to these numbers?
Well, it's expected. It was expected. The online versus in person is very different. The children are at home. Many are very comfortable, and it doesn't matter sometimes if the teacher does somersaults, I don't know, to get their attention. It's just not the same. And the most important thing for a child is the social emotional is very important. If that's not met and it's not there, the child will not learn. And when you don't have that child in person and they're online, there's a lot of disconnect, right? It's really hard. I know because I had, well, they were all on virtually. I was teaching them virtually in the beginning, and half of them were not paying attention, which is, I mean, they're at home, they're comfortable. But once I got them in the classroom, then things changed. But again, I still had a few online, and I just know that it could have been so much better if they had been in person. Like I said, the social emotional, you can't get that same outcome virtually. This is my experience in working with small children. You just can't. But even the older ones, my daughter was in college. She's 20 years old, and she got out. She quit because she couldn't do the virtual. It just wasn't for her. She was not doing as well as she was when it was in person. So it's the numbers are correct. I mean, the learning is not the same if you're not in person.
Well, thank you, Mari Cruz Martinez. Yes, it has been a challenging year. And then we also have a question for Inga Cotton. Is there any way parents can actually help get their kids back on track with the test scores?
I'm glad you asked that. I want to reinforce what Mari Cruz said. No, the children she's teaching are too young to take the STAR test, but if your kid was in grade 3rd or up last year, they probably did take the STAR test, or at least they had the opportunity. And there's other types of tests that schools administer as well, like MAP testing. So the test is a diagnostic, and it can help you identify what areas kids might have missed. And it's not a matter of blame. It's just a matter, because we all went through a really difficult time. But it's a matter of, like, once kids are back on campus and they have that engagement, find out what things they missed. So you can actually look at the STAR test, figure out which questions your kids missed. And if you see a pattern, like, oh, they missed some questions about fractions, or they missed some questions about multiplication or reading comprehension, you can actually go to your kid's new teacher this school year and say, hey, how can we help my kid get caught up? Is there some time during the day for personalized learning? Is there a tutoring session? Is there something we can do at home, like reading together or flashcards or something, and just individualize to figure out where those gaps are? And we're actually doing some free workshops through San Antonio Charter Moms. We have a testing expert, and he'll show parents how to read a STAR report card and how to find those personalized learning resources based on your Lexile score. So you can ask the librarian what's the right level of challenge on an engaging topic for kids to read. So it's a matter of, like, maybe stop being scared of the STAR test, look at it as a tool, as a diagnostic to help kids get back on track for the coming school year, because we have a lot of ground to catch up. But being said, we must take care of their social emotional needs first. They have to feel comfortable, they have to feel engaged, they have to feel safe.
Thank you, Inga Cotton. And from transitioning from summer mode to school mode can be difficult enough for parents and students even without COVID concerns. So Ashley, Jesse, we want to pose a question to you. What can parents do to get their kids back into a routine?
I think it's super important to prepare them for something that's new. And for many families, going back to school in person is new. And so what we can do is to include them in preparing for the new school year, so that, and making sure that they're going to meet the teacher night and walking around the school and maybe getting to meet some new friends and seeing where their classroom is, letting them help to pick out school supplies. That can help. Anxiety happens when we feel like we don't have control, or when there's something we're unsure of. And when we can prepare for those things, it helps. I think listening to their concerns is important. If they have any questions, I like, for my little one, when I pick her up from school, I ask, what was the worst thing about today? And sometimes she says there was nothing. I'm like, good. And other times she'll tell me, maybe there was something that was a little bit more difficult, and we'll talk about that. And then I say, well, what was the best thing about today? And so then we end that conversation on a positive note. I think offer reassurance. I'm here to listen to you. You'll be safe. You know, we'll do everything that we can to make sure that you're comfortable going back to school. Establishing a regular bedtime routine is really important. And this, we know this happens every summer. You know, we get into a little bit more of a relaxed routine with our children. We let them stay up a little later and watch movies and do fun things and then sleep in. And I think it's important to, again, start getting back into that before school. If you can try to, at least maybe a few weeks beforehand, you know, start turning lights down lower around maybe an hour or so before your child's bedtime. You know, you can put on relaxing music, let them take a warm bath. And this is a tough one because we all know kids love electronics, but keeping them off of the electronics, the iPads, and off the TV at least a few hours before bed. I know that's really, really challenging, but that light coming from that device tells your brain that it's time to be up. And so it's hard to go to sleep and get good rest when, you know, you're wide awake. So making sure that they're going to bed at a regular time, having a regular bedtime routine, but also a regular wake up time and time for them to have a little bit of breakfast and to prepare for the day is so important so things aren't rushed. I've been guilty of having those rush mornings where we're just like grabbing a granola bar and running out the door just because we maybe had a busy night or something. But those schedules are really important. And then this is the most important thing, I think, is that as parents, we monitor our own feelings and talk to other people if we're feeling stressed or overwhelmed. And that will help to model for your child. You know, mom's feeling a little worried, but, you know, she did something to help herself to feel better. So it just models for them, yes, everyone gets anxious, but there are things we can do to feel better and take care of ourselves. And, you know, that includes exercise and eating well. We all know that. But trying to do those things, getting outside, getting fresh air, those routines, talking with your child, all of that together will help make transitioning back into school much, much easier.
And these are great reminders. I have a question for you guys, whoever wants to answer, but I guess, you know, in general, we should have different expectations for students coming back. I mean, we have students who are coming back to school who had already been in school in person for some time. We have some kids going back to school who just got off of summer school, and then we have some kids going back to school, in-person school, who are going back in person for the very first time, who did the entire year virtual learning. I guess we should remind our parents to have different expectations from our students.
We've been talking to schools about how they're adapting. So there's a new school opening on the northwest side, the Entrake, it's Fire Academy at the JCC. It's on Northwest Military. So they're going to open K through second grade, and they're assuming that most of the students, even some second graders, may have had less than a year of on-campus learning. And so they're putting extra energy into orientation. And so it's part of like just learning how to function in a classroom, like how to sit in your chair and, you know, where to put your pencil and, you know, building in lots of wiggle breaks. And so it's very much like what Ashley was talking about, that anxiety comes from not knowing what to do, not having a sense of expectation or belonging. And they're just going to be very deliberate about communicating that to the kids and to the families. But it's a team effort. And same thing, there are, you know, that transition from middle school to high school involves more independence. And so there are, you know, 10th graders who never experienced high school before, and they did distance learning at home. And now even some 11th graders had just barely a little bit of high school before schools closed, you know, the never-ending spring break. And so there's 10th, 11th graders who need the same kind of coaching about how to do high school that freshmen did. So it's like the world's biggest freshman class.
And it's very important. I'm sorry, I just wanted to chime in. It's very important to the communication between the teacher and the parent, the, you know, continuous communication, for the parent to feel comfortable reaching out to the teacher, for the teacher to feel comfortable having those conversations with the parent about where their child is, that support between, you know, that relationship, that teacher-parent relationship. And within our district, we have many parent programs that support parents, that help them, that guide them, that, you know, give them kudos and, you know, just help them to try and feel comfortable about different transitions or something new that's coming up. We have a great, it's called the Parent Salsa Center here. And then they just offer online in our website, they offer many things that will support parents to feel stronger or to know how to be able to reach out to, an educator or whoever they need to speak to that's on the campus, their child's campus. So that relationship between a parent or a family and a teacher, that is one of the best things and most important things that needs to be solid, for things to really work well.
And just to reiterate, Maricruz and what she's talking about is thinking about resources. So yes, a parent, is trying to prepare their child, but what if that preparation isn't enough? What are your other resources? There's school counselors, there's psychologists, within the community that families can outreach to. They can outreach to their pediatrician, and their pediatrician knows about resources. So know that sometimes you can't do it alone and you need those outside resources. So just to reiterate that concept as well.
I think that's very important, and also a reminder to all of us parents and educators to be patient once again. One more question for Maricruz Martinez. We were wondering, with your experience with the little ones, pre-K, and especially during COVID, some parents were wondering when the child becomes of age just for pre-K, should they hold off on sending them, or should they very much send them to school? What would you say about that?
Send them. It's fun. Pre-K is fun. Pre-K is amazing. 3-year-olds, 4-year-olds. Wow. Even as adults, we can learn so much from them. And I do. I have. And yes, send them. That social emotional part is so important. None of the learning will, happen or be as strong if that social emotional part isn't there. And I'm talking about, them coming in, making friends, knowing how to communicate, learning how to be themselves, and just learning through fun. It's very important. Yes, send them 3-year-olds, 4-year-olds, welcome. It's very different from just staying at home. I mean, I know those kiddos would love to stay home and play, but you're here at school, because I have had many that come and they don't want to be, but a week, maybe about a week of difficulty, and then they're fine. Then they're like, bye mom, bye dad, see you later. And after school, sometimes they're like, I don't want to go home, so send them 3-year-olds and 4-year-olds, send them.
Thank you so much, Maricruz. And to wrap up this live stream, I want to give each of you a chance to give some final thoughts. What would you like parents to remember most going into this new school year? So let's go ahead and start with Inka Cotton.
Boy, I think just give your kids lots of hugs. Let them know that you have faith in them. And to echo what Maricruz said, communicate. Keep the channels open with your kids' school. Because they're trying to make the best of kind of a confusing situation and all the constraints that they're under. And then to echo what Dr. Svatek said, we can all pitch in. If we, keep your kids home if you think they might be sick. Wear masks. Just be a team player, and we can prioritize education and getting our kids back on track and help them have a better future.
And what about you, Ashley? What do you think?
I think, and just kind of going back to what I said before, just letting your children know that you're there for them. And then also just being aware. I think it's really important to be aware if you notice any mental health concerns in your child. With very young children, we typically see when they're feeling depressed or anxious, sometimes they might act out aggressively in those areas, but sometimes they might have regression, maybe trouble sleeping, not eating well. You'll see those physical symptoms of mental health issues, but then you also might see some, if they're potty trained, they might start having accidents, like wetting the bed and those kind of things. If you notice anything out of the ordinary with your child, talk to them. You can take them to see their doctor. You can get counseling, and just like everyone has said today, just make sure that you're taking care of yourself and then also taking care of them and seeking out help where you need it, whether it be from your child's teacher, from a counselor, from your doctor, from other parents, from family members. Get that help if you need it. We're all trying to figure all of this out, and there's so much uncertainty, but there are things that we can do to get through it.
All right, thank you, Ashley. And Dr. Swatek, what do you want parents to remember?
That we're in this together. So just like reiterating, I'm a team player. I think it's important anytime that we live in the society that we do, that we were equal and we provide all resources and we educate the right way. And things are fast in motion right now. And there still remains this uncertainty. But if we are in this together, and how can we be in this together? We can talk about masking up right now. We know that the greater than 95% of the cases right now are in San Antonio, the Delta variant. And for those that are unvaccinated, it's, 9 out of 10 of those patients that are hospitalized are unvaccinated. And so we know we have to think about vaccines for 12 and above. We have to think about mask wearing. We're in this together. We want to protect everybody in our society. And that's so important. I don't want to see a kid sick in the hospital. I don't want to hear of a family member dying that can no longer, that child doesn't have that parent. What I want to hear is that we got through this together. We masked up. We, weighed the risk and benefits of vaccines. We really thought about talking with our children about receiving vaccines. And then when those vaccines come for children under 12, really thinking about that and starting to move forward and enriching yourself with pieces of information about those vaccines, looking at your resources from the CDC, the FDA. We're in this together. Mask up, San Antonio.
All right, thank you, Dr. Mandy Swatek. I appreciate it. Also, just really quick, just any last thoughts for parents there, Maricruz Martinez?
Yes, parents know, again, we are in this together. We want to be safe. We want to keep each student safe. When you leave them to us, they become ours. And we here in school, in all schools, we're here in the district, in Harlandale Independent School District. I know we're going to continue with the PPE, the personal protective equipment, right? We're gonna, of course, ask everybody to wear masks, the hand washing, the plexiglass, in all elementary schools, because of course 12 and under cannot be vaccinated. Just the safety, all water fountains are closed. We have watering stations. We will continue that, and just know that we are here. Like I said, when you leave them at our door, they become ours. So we are going to do everything that we can, as we did last year and the year before, to keep them safe. We want everybody to be safe, and we're going to do, as educators, I know that all educators are doing the best to keep your child, our child, safe.
All right, thank you again, Maricruz Martinez. And we also asked Superintendent Pedro Martinez his final thoughts and how he's feeling about the new school year that starts on Monday.
Well, I'm excited. I'm excited because August 9th is our first day of school. We're one of the first districts that are going to be open, but we already have a soft launch that we've done starting last week, and the energy level is very, very positive. With that, Alyssa, I'm very, very aware of the challenges that our children went through last year. So one of the things that I'm asking our teachers, our parent and teacher communication has never been stronger. And one of the things that I'm asking our teachers and our administrators is to keep parents at the table, have them there with us. We've asked every school to create their own customized academic plan. And we said, and like I said, over 90% of the campuses are open right now in July. That was part of their plan. But we also said to them, adjust and pivot as you need to, and just have parents there at the table with you. So if you see that some children are struggling, let's figure out what's the best way to support those children, whether it's more instructional time on the weekends, on the evenings, whether it's more support in terms of therapists, whatever those things are, we have the resources, Alyssa, to be able to support our schools. So that's what's exciting for me, is that the need is great, but we've never been better prepared in terms of our resources, and the energy level is really high right now with our staff.
Again, that was Pedro Martinez, Superintendent of SAISD. Now, we understand parents still have a lot of questions regarding the vaccine, especially when it comes to young children. That's why we are hosting a KSAT community phone bank this evening. Now, this starts at 5 o'clock until 7. We'll have a group of doctors and nurses on standby to answer your calls and your questions. So tune into the news at 5 or KSAT.com to get the number to call. And another quick reminder that next Wednesday on August 11th, Ursula Perry will be hosting another back to school town hall. This one will be focused on students in middle school and in high school. And we're going to dive into more topics like mental health and the digital divide. That's happening next Wednesday at 7 p.m. after the 6 o'clock news. And I want to thank all of you guys. Thank you, Dr. Mandy Svatek, Maricruz Martinez, Ashley, Jesse, and also Inga Cotton for joining me this morning. We really appreciate all your comments, all your feedback. Very helpful for us parents.
Thanks for having us.
And thank you guys for joining us.
Thank you so much.